Hi, thanks for watching. In this video, you'll learn about Symjepi, its use, and important safety information. Symjepi is a disposable pre-filled epinephrine syringe for patients who are at risk for severe allergic reactions. It is intended for patients who weigh 66 pounds or more. Each package contains 2 Symjepi syringes. Severe allergic reactions may require more than 1 injection, which is why it's important that you have 2 Symjepi syringes with you. You should always store Symjepi in its plastic case and make sure it's ready to use in case of an emergency. This means refilling your prescription before it expires. The easiest way to check this is to look for the expiration date here. You should also periodically check the contents of the syringe by looking through the solution window. The solution should be clear, but if it's discolored, cloudy, or contains particles, replace the syringe. Since you never know when an anaphylactic reaction will happen, be prepared by having Symjepi with you and by knowing how to use it. The instructions I'm about to give you will help you or a caregiver learn how to properly administer the Symjepi injection. If there's an anaphylactic emergency, here's what to do. First, sit down and find the injection area. It should be in the middle of your thigh, halfway between top and the side. Next, take Symjepi out of its case and hold the sides of the syringe with your thumb and fingers, like this. Then, remove the needle cap with your other hand and discard. When you're ready to inject, point the needle down and push completely into the thigh, all the way through your clothes until it's no longer visible. Press the plunger down until it stops and clicks. Hold for 2 seconds. The injection is now complete. Please note that excess liquid will still be in the syringe and can never be used. Once you've done this, remove the needle from your thigh. Slide the safety guard down over the needle until it clicks into place. Put the syringe back in the case and snap closed. Gently massage the injection site for 10 seconds. Once you've used Symjepi, seek medical attention right away. Go to the nearest hospital emergency room or call 911 and tell your healthcare provider that you received an injection of epinephrine. You may need a second Symjepi injection if your symptoms continue. Get immediate medical help for any further doses. Take the used Symjepi syringe in its case with you to the hospital emergency room for proper disposal. Contact your physician to refill your Symjepi prescription. If you're administering Symjepi to someone else, the steps are the same. Have the person sit down and find the injection area. Open the case and take out Symjepi. Discard the needle cap. Inject the needle pointing down into the middle of the outer thigh. Press the plunger down until it clicks. Hold for 2 seconds. Remove the needle from the thigh. Gently massage for 10 seconds. Slide the safety guard down until it clicks into place and put Symjepi back in the case. Take it with you and go immediately to the hospital emergency room. Bring the used or expired Symjepi syringes to your doctor's office or hospital to ensure proper disposal. Ask your physician to refill your Symjepi prescription. Now you know how to use Symjepi in an emergency, but we still have some important safety information to share with you.
Indication. Symjepi is indicated in the emergency treatment of allergic reactions, type 1, including anaphylaxis to stinging insects, e.g. order Hymenoptera, which include bees, wasps, hornets, yellow jackets, and fire ants, and biting insects, e.g. Triatoma mosquitoes, allergen immunotherapy, foods, drugs, diagnostic testing substances, e.g. radiocontrast media, and other allergens, as well as idiopathic anaphylaxis or exercise-induced anaphylaxis. Important safety information. Contraindications. None. Warnings and precautions. In conjunction with use, seek immediate medical or hospital care. Do not inject intravenously, into buttock, or into digits, hands, or feet. To minimize the risk of injection-related injury, Instruct caregivers to hold the child's leg firmly in place and limit movement prior to and during injection when administering to young children. Rare cases of serious skin and soft tissue infections have been reported following epinephrine injection. Advise patients to seek medical care if they develop signs or symptoms of infection at the epinephrine injection site. The presence of a sulfite in this product should not deter use. Administer with caution in patients with heart disease, may aggravate angina pectoris or produce ventricular arrhythmias. Adverse reactions. Adverse reactions to epinephrine include anxiety, apprehensiveness, restlessness, tremor, weakness, dizziness, sweating, palpitations, pallor, nausea and vomiting, headache, and/or respiratory difficulties. Drug interactions. Cardiac glycosides, antiarrhythmics or diuretics, observed for development of cardiac arrhythmias. Tricyclic antidepressants, monoamine oxidase inhibitors, levothyroxine sodium, and certain antihistamines potentiate effects of epinephrine. Beta-adrenergic blocking drugs antagonize cardiostimulating and bronchodilating effects of epinephrine. Alpha-adrenergic blocking drugs antagonize vasoconstricting and hypertensive effects of epinephrine. Ergot alkaloids may reverse the pressor effects of epinephrine. Use in specific populations. Elderly patients may be at greater risk of developing adverse reactions. Please see the full prescribing information and patient information at www.symjepi.com. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch/ or call 1-800-FDA-1088.